Charter California Edition. I'm Brad Pomerance. Our guest, Ed Hernandez, member of the California State Senate. And sir, as you know, the U.S. Supreme Court considered what we know as Obamacare, the Affordable Care Act. Two parts to the ruling. The first part said that individuals could be required to obtain health insurance. The second part was different. The court ruled that the federal government could not require states to expand Medicaid, or as known in California, Medi-Cal. So each state gets to decide. What has California decided?
Well, as you know, the governor called for a special session, and in that special session, he asked that we address this issue. We are moving forward. California has and always will take a leadership role, and just recently the governor signed that into law. So
California is accepting the expansion. Yes. I know that has been very important to you. You're a doctor of optometry. You often treat individuals who face challenging circumstances as it relates to their medical care. Explain to me what the expansion will do for many Californians.
Okay. Well, let's first talk about what we currently do.
Please.
We currently pay for Medi-Cal, and it's what's called a 50-50 match, where 50% of the money is paid by the state of California, 50% by the federal government. That's up to roughly around 100% of poverty level. This expansion will pay up to 138% of poverty level, so there's going to be more individuals eligible. It's approximated 1.5 million new Californians will be under this system or brought in. But here's the good news, is that the federal government for the expansion population will be paying 100% of that amount, and that drops to 90% in 2020.
So it will cost California nothing. Until
Initially,
the next decade.
Yes.
That being said, there was some fear in the executive branch of our state that the feds would change that formula, or could change that formula. Yes. So as I understand it, in your bill, which was recently signed, there is a protection.
Yes.
What's the protection?
Well, keep in mind that the administration thinks or feels that potentially in the future the administration that is at the federal level may not pay the 90% and drop below that. But I'm convinced that the president made it a priority. California is moving forward. He's put that in the budget, that won't happen. But just to make sure that the administration's comfortable, we said in the bill that if it drops below 70% of federal dollars, keep in mind we're now doing a 50-50, that the state of California has a year to determine if we're going to continue to fund the expansion. And we've always funded Medi-Cal, and I anticipate that this legislature will continue to fund it, but that's a discussion to have in the future.
The other issue relating to Medicaid is California is notorious for paying doctors a low reimbursement rate for those that serve Medicaid populations. I believe we're 50th.
Yes.
And so what has happened is many doctors have taken the position they will no longer accept Medicaid patients. How are we going to handle this if we are expanding Medicaid by up to 1.5 million?
Yeah, no, I agree. And we're the 49th or 50th. We're one of the lowest paying to our providers. But there is some temporary relief in the sense that once the Medicaid expansion occurs, the federal government will be paying doctors at a much higher level, as high as 100% of Medicare, which is quite a bit higher than the Medi-Cal expansion or the Medi-Cal fee.
Sure.
So that's good news. But in the legislature, and I've already started having those discussions with leadership, the pro tem, the speaker, we need to make sure that that money is available after that dries up so that we can continue to service this population.
Look, there's no doubt that there were some serious cuts made during this recession. And Medicaid took serious hits in terms of reimbursement rates. But we are now on the other side. At least our state budget appears to be on the other side of the recession. We are in surplus, it appears. And so my question becomes, I know in education we've restored to pre-recession levels for K-12. What about for Medicaid? Are we getting close to restoration of reimbursement rates?
Yes, that's part of the discussion now in the legislature. If you look at what happened, yes, we had to make some horrible cuts. And education would have been the last one, but the voters passed Prop 30 to allow us to make sure we can get through that hump. The economy's picking up. We passed the balanced budget. We have additional revenues coming in. we are looking at restoring, and I'll give you an example. Look what we did in this budget. We restored adult dental.
That was a huge fight.
Huge fight, but we restored it. And so we're moving forward piece by piece, and I think the conversation of reimbursement rates is going to be part of it next year.
But I have to ask you, why is it that K-12 was so easily restored to pre-recession levels, and yet healthcare not?
Well, for a couple of reasons. Number one is K-12 through Proposition 30 was what was on the ballot, and the voters knew that. Well, the hard reality is education's important. I'm the biggest advocate of education, but I really think that the electorate doesn't look at healthcare in the same light, and they're less likely to vote on increased revenues for the most neediest. And it's unfortunate that the most neediest are usually the ones who don't vote.
Right.
So I really believe that we need advocates like myself to advocate for the poor, and more importantly, the individuals who need the care the most, that we need to make sure that as the money comes back, we advocate to make sure that those reimbursement rates, but more important, the services come back.
I also want to ask you about other states and where they're going with the potential Medicaid, called Medicaid expansion. What we heard in the wake of the U.S. Supreme Court decision is a lot of blue state governors saying, we're going to take the expansion. A lot of red state governors saying, we're never going to take the expansion. There has been some movement, though, on this question. I know you've been following the trends. What have you seen in terms of other states accepting or rejecting the expansion?
Exactly what you said. As soon as the Supreme Court made their decision, all the red states said no, the blue states said yes. However, they're realizing now all those federal dollars that are going to come into those states, and the lobby from whether it's the hospital, the provider groups, the advocacy groups, and you're seeing those states start to move in that direction. That's Arizona, yes.
With a very red governor, Jan Brewer. I mean, she apparently pushed through a very Republican legislature the expansion of Medicaid.
Well, think about it this way. Those dollars, 100% federal dollar, that's a lot of money coming into the state that creates jobs, more doctors get paid, more providers there. Patients are going to get better access, lower healthcare costs, lower out-of-pocket costs for the patient. That's a significant amount of federal dollar that's going to be available for the economy within that state.
I want to ask you about a population that I think may slip through the cracks. So you have folks that are part of Medicaid through either the initial or the expansion. You have folks that get insurance from their employers.
Right.
You have folks that will jump on the exchanges. Some of those will be subsidized, but then there's still a population that may not qualify. It's kind of this lower middle class population. Right. Am I right?
Yeah, and there's a population that, let's say it's a farm worker or somebody who works in the restaurant industry where it's seasonal, where 1 year they're below the 138% and they're in Medi-Cal, but then a couple months later they're above, and then they have to move into the exchange where they're going to have to pay for that product. Well, we're running in the legislature right now what's called the Bridge program, which will help those individuals, and this is what's called churn, where they go in and out of Medi-Cal to the exchange, to help them make sure they keep their provider, make sure they get an affordable product at a lower cost.
Almost like Cobra?
Kind of like, and it's just kind of that little bridge that gets them to. So let's say they are working their way up, they go to college, they get that better job, they make a little bit more money. It's sort of that little extra assistance to help them out.
I mentioned exchanges. There's been some fear that the states aren't ready to really launch the exchanges. I know California, even in the Schwarzenegger years, was planning for the exchange system. How are we doing?
Well, I tell you, California is way ahead of the rest of the country. First to have an exchange, first state to do the 10 essential health benefits, which define habilitative and rehabilitative services. But more important, the exchange is ready to go. They have the plans that have already put in contract. But the best part is the cost to the consumer is much lower than we ever expected.
Even young and healthy?
Yeah.
Really?
There was some expected costs to be much higher than they thought because they weren't sure what the bids were going to come back. I'll be honest, there's going to be some bumps along the way. The shop will be a little bit behind. But, California is moving forward.
Okay.
They're moving forward.
He's Ed Hernandez. He's a member of the California State Senate. I'm Brad Pomerance. This is Charter California Edition.
When all is said and done, how many states are expected to participate in the Medicaid expansion?
I'm Brad Pomerance. You are watching Charter California Edition. We are joined by Scott Svonkin. He is a trustee at the Los Angeles Community College District. He is now president of the Los Angeles County School Trustees Association, which includes trustees at all levels, K-6, K-8, K-12, yes. Community colleges.
Correct.
Why are you doing this?
Well, I believe that in Los Angeles County, we need to lead the state in advocating for our students and for our communities. Education is the great equalizer, and as president of the LA County School Trustees Association, it is a chance for me to coordinate across the county, both K-12 and community colleges, to work together to help people be ready for college and help people get into college and help us work together better.
Let's talk about education funding. There's no doubt that Governor Brown has a real soft spot for K-12.
Yes.
The amount of funding that was provided to K-12 in the new budget is quite dramatic and creates formulas to educate more challenged students. But I want to focus with you on the community college side. Do you feel as if community colleges got adequate funding considering the surplus, considering the surge?
I don't. I think that the governor was very cautious, which is a good thing. But I think the public understands that community colleges educate and re-educate more people than the UCs and CSUs combined. And we have lost over $140 million in the last 5 years and in Los Angeles at the community colleges, and we need to be restored to full funding.
So K-12 is being restored vis-a-vis 2007-2008 levels,
right.
Pre-recession levels. Community colleges, CSU, UC is getting, I think, a 5% bump.
Right.
I presume that's not restoration of pre-recession.
It's not. It's a little bit of extra help. We're going to be able to open more classes next year, but it's not enough. There is a tidal wave of students who want to go to community college and want for a second chance, for a new career, and we don't have space.
But why is it that K-12 has been so effective in lobbying, or whatever term you want to use, to get to pre-recession levels, yet the constituencies for community colleges, CSU and UC, could get but a 5% bump when the cuts were in total what percentage? I mean,
probably
25,
20,
30,
25, 20, yeah, 20, 25%.
Why?
Well, I think the governor understands, and this is one of the challenges. Our biggest problem our students face is they come to us not prepared.
Especially in community colleges.
Exactly. And so I agree with him that it's important to invest early. The earlier people get help in preschool, in kindergarten, the earlier we help our students to prepare them, the better they do in their lives. So we really wanted to work with the K-12 system, and that's my focus. There are two things I'm focusing on as president of the LA County School Trustees Association. One is the relationship between the K-12 and the community colleges. How do we work better together to prepare students for college? The second issue is how do we get guns out of the hands of people that do terrible things on our community colleges and our elementary schools across this country.
Let's talk about guns, if we may. One of your sister districts recently faced a horrific situation.
Right.
I'm talking about Santa Monica City College. Now, admittedly, this was not a situation a la Virginia Tech or Columbine where the shooter was targeting the campus, but this shooter wound up on the campus of Santa Monica City College. I believe that one student did perish.
Right.
What's your sense of what community colleges can do, what K-12 can do? I mean, these are scary times.
Well, I'm leading the effort to make sure there are no guns on our community colleges. Currently, the NRA teaches a class at our colleges, and I'm working closely to make sure that we don't allow guns on our campus. The only people that should have guns on community college campuses are the people protecting our students. We also need to do a better job, and we need funding to screen people for mental illness, because virtually all of these people that have shot up these campuses across the nation had some form of mental illness. And the earlier we can intervene, the more screenings we can do in middle school, high school, college to find these people and get them help, and not allow them to get access to guns, the better we will have and the safer we'll have our communities.
It's interesting. I would presume that K-12 would have a bit easier time doing screenings because these are minors, although would they need parental consent? A little complicated. What about community colleges? You're now dealing with adults.
Right.
And so is it harder to get individuals into screening if a teacher or professor senses an issue?
I think that we have some ways to encourage and force if the student's disruptive. Unfortunately, the gentleman that shot Gabby Gifford, he was a community college student, and
Congresswoman Gabby Gifford in Tucson, Arizona.
In Tucson, Arizona. And just weeks before the incident at Santa Monica, there was a scare at East LA Community College.
Yes, I remember.
There was a phone call to the CHP, and they were tracking a gentleman who had made a threat. And we need to do more to make sure our campuses are safe and make sure we're working to get people help earlier and to get guns out of the hands of those people that are most dangerous.
But how? I hear you, but is it within the purview of the community college system?
Well, it's our job to protect our students, and it's our job to help those with mental illness. So I think, yes, I think it is, because making sure that people with mental illness don't have access to guns, I think it's all of our responsibility.
So could you, for example, ban guns on your campus?
Yes, and in fact, I'm going to be authoring in the next few weeks a ban of guns on our campus.
But for law enforcement?
Yes.
Good luck to you. I mean, how's that going to work out?
I think it's going to be successful. I think everybody on the college board understands how dangerous it is to have guns on campus. The public doesn't. You can't tell if there's a bullet in the gun. So what some advocates for gun control have wanted to do is they've advocated for open carry, but law enforcement is put at risk because of the fact that there's no way to tell, is there a gun in the chamber?
Have you heard from the NRA?
I have not, but I've been involved in fights with the NRA before. I worked for the author of one of the first Saturday night specials in California, Paul Koretz. I worked on a ban on 20 caliber bullets. My hope is not to take away people's rights to own and bear guns to protect themselves and their families, but we don't need guns on our campuses, and we don't need guns in the hands of people that are mentally ill.
I want to talk about another one of your sister districts, and that is Long Beach Community College District. Right. They are proposing, and they have found a member of the California Assembly to support and author a bill which would allow community college districts to charge more money for intersession classes when those classes had been impacted in regular session. Santa Monica City College had tried a version of that.
Right.
It went down in flames. This is a bit different because their version, I don't think, was intersession, but just general.
Right.
What do you think of LBCC's proposal, which doesn't mandate a community college district to offer intersession at higher levels, price-wise, but allows it?
Well, I think it's really important for us to rebuild our class offerings, and anything we can do to help students get through community college faster is a good thing. The problem is that community colleges are the opportunity for people who don't have a lot of money to get an education, and anything that raises the cost shuts people out.
But couldn't one argue that if the classes are impacted, they will have to wait another semester to take the class, which is more money waiting, but if you could just spend a little more 6 months earlier by taking intersession, you save money in the end.
It is, but most of our students can't afford it. They can't afford to pay more because every time the state raises tuition, we lose students.
Some could.
Some can't.
And so it could decrease the impact for the students that can't pay, so they could have the class the semester earlier.
Well, if we were talking, and I have actually discussed with our community college interest groups, having a program where people pay more and it opens up seats for other students, that would be something I'd be interested in.
But wouldn't this by definition do that?
No, because it doesn't guarantee, as far as I understand, it doesn't guarantee that there'll be more seats for students that need seats.
Okay, his name is Scott Svonkin. He is a trustee with the Los Angeles Community College District, also president of the Los Angeles County School Trustees Association. My name is Brad Pomerance. You're watching Charter California Edition.
How many students are enrolled in community colleges across the nation?
It's Charter California Edition. I'm Brad Pomerance. Our guest, Phil Hu. He is the Vice President of the San Gabriel Unified School District. He's running for re-election. That election will be held in November 2013. And sir, I want to speak with you about the recent budget that was passed out of Sacramento. A real revolution in how we will fund education.
Yes.
There were some negotiations that allowed funding levels to at least match pre-recession levels as a base grant.
It's a great thing.
Which is a good thing, I'm sure. But your school district, like many, will get additional funding because you educate higher numbers of English language learners, foster kids, and economically disadvantaged. What do you think about that change?
Well, since I'm coming from that kind of a district,
right, it's a good thing.
That's a very good thing, right? It's a very good thing. It's a much needed thing. I mean, baseline, I believe the figures for us, we're going to get 1.6 million from the LCFF, right, the local control funding formula.
Right.
And then there's two other supplemental grants, I think, that comes along with that. And we will get a nice sum of money from there.
So the first part of the grant, the supplemental grant as we call it, is for each child that falls into one of those three categories. There's a 20% bump. But then with the concentration grant, if a school district educates more than 55% from that category, another 50% bump. That, I see you smiling, but that's a 70% bump. I mean, is there a 70% difference?
Hard to tell, right? Hard to tell, but I can tell you, having been an English learner, right, when I first came here.
Right, tell us about that. You just mentioned to me.
Yes, well, I wasn't born and raised here. I came here when I was 8, and came here armed with 2.5 like other languages, but no English whatsoever. Tracked into ESL.
Right.
I can tell you, from experience, clearly, the faculties are there, the capabilities are there, but the language is a big, it's a big obstacle. And I think for those who are coming over here, just getting in there and learning the language, I think it's important. I think we should have additional resources for them.
How long did it take you to learn?
The first year was a struggle, but by the end of the first year, I kind of picked up on it. I was getting the reading down.
Right.
In fact, the second year I was in, they tracked me into an honors class.
Why? I tease.
Because I'm brilliant. No.
I want to speak about languages generally. It's interesting how the pendulum swings one way or the other. There had been this big push to have only English taught in schools, maybe some foreign language in high school, but now we're looking at a new trend which is called dual language immersion.
Yes.
And it's the hottest thing in California. I recently spoke with someone in Burbank. They're launching a Spanish immersion program. Culver City has it. Some of LA has it. San Gabriel is looking to do the same.
We are. We started this about 6-7 months ago. And in fact, you mentioned the re-election. This is really one of the big things I really want to make sure, we get going. Because I think this transforms the district, and this transforms, I think, all of our students' lives from hereafter.
For our viewers who are not from Southern California, give us a sense of the demography of San Gabriel, because it is an ethnically rich and diverse community.
It really is. I believe we have, inside our school district anyways, we have almost now, I think almost 60% that's API, Asian Pacific Islander. There's another 34% or so that's under the Latino umbrella.
Sure.
And then the rest is just kind of divvied up, right? So,
And the API are mostly individuals of Chinese descent?
I would say most of them are.
Right.
But we do have Vietnamese, Japanese, and other Southeast Asian.
Right.
The majority of it is.
And so those individuals of Chinese descent, are they coming with English language skills?
Some of them.
But here's the beauty of these dual immersion programs. As I understand it, the perfect blend is students who are English dominant and students who are dominant in that other language.
Right.
Is that what you're looking to do?
There are many, we're still in the process of studying, so there are many avenues to follow. Some of the examples that have been brought to us that have been successful, they all kind of start in kindergarten. But there are some that have started with kind of what they call a 90-10 split, which is 90% in the other language.
The non-English language.
Right, the non-English language, and then 10% in that year in English. And then they go, 80-20, 70-30. And eventually, I believe, up to like about their 6th grade year or so, it becomes half-half, and then eventually, they just...
Well, but let me ask you, in Burbank, for example, they're looking to go K-12. Wow. Most immersion programs are stopping at 5th or 6th grade.
Right.
I know you're in the study phase. Where are you?
Right now, I think we're looking at going carrying it through the middle school, which
Right.
for us would be at 8th grade.
Okay.
So far, that's kind of what we're looking at.
What's fascinating to me about these dual language immersion programs is one of the areas that is absolutely positively taught in the other language is math.
Yeah.
And it's so interesting to me that math would be taught, and why not?
Right.
But if you think about it, it really doesn't matter how you learn in terms of language acquisition and
Right,
math.
right.
It's the same.
It's all numbers,
concepts.
right? Yeah.
So what languages are you looking to pursue for dual language?
We are currently looking at 2 languages. The 2 languages that make the most sense for our demographics in San Gabriel Unified, and also just, I think, simply because we live in Southern
Sure.
California. We are looking at pursuing one in Mandarin Chinese.
Makes sense,
And then
San Gabriel.
Yes, and the other one in Spanish.
Okay, I mean, it's a perfect fit. So where do we stand? I know you're in the study phase, but do you think that maybe fall 2014?
I believe I heard our superintendent mention this the other night, that's kind of the target right now, is
Right.
fall of 2014.
And how will a student be admitted into the program? I assume you'll start in kindergarten, so
Yes.
if you're lucky enough to be 4 or 5 at that moment, you're
Right,
good, but then
right.
what? Is it pure lottery?
That's yet to be determined.
You're studying
it
that?
really, because, and I'll say this, some of the examples that have been brought to us, other
Right.
districts, their immersion programs have been around for, 8, 9, 10 more years,
Sure.
and they all say that they are thriving and people are dying to get in. It's created a different problem for them,
Right.
kind of a good problem, I think.
We tried to get my daughters into a program,
Right.
and we were not admitted. I mean, it's very hard to get in. It's lottery, and it's all luck.
But that's an established program.
An established program could
All
not
these
get
programs that we've been shown so far in the first year or 2 of their startup have had struggle just a little bit because it's
Interesting.
new, it's different. People aren't sure if they want to do this or not.
I wonder, though, given the increasing popularity, if when you launch, you'll be oversubscribed.
I hope so.
Right.
I hope so.
So, in terms of finding the talent, is that a challenge?
That is consistently one of the common obstacles or challenges, right, that
Right.
these districts have run up against has been finding the people with the credentials and a strong enough proficiency
Right,
in
because
the
in
language.
kindergarten you only have one teacher,
Right.
maybe an aide. So it's
Right.
not as if you can, split up the day and have the Spanish lessons be in one set of rooms. I mean, it's
Right,
kindergarten.
Right.
I want to talk to you about another area, and that's preschool. What's happening with San Gabriel as an example? Are you looking? I know that TK is going to be launching or has launched.
We are doing TK already
You are.
currently.
So what about on the preschool side?
Well, in preschool, I think, as you know, at some point there was funding for some of
At
that,
some
right?
point.
Definitely through Head Start
Right.
programs and such. But most districts that I know of now don't do anything with preschool in their own districts. A lot of that stuff is, if they provide preschool, it's kind of farmed out to some other organization that comes in, right? Or parents just have to find a preschool around them. This is, and thank you for bringing this up, because this is
Please.
a really kind of an issue that's close to my heart, because I do have 2 children, and one of them, well, they were both in preschool, and the older one is actually going into kindergarten.
Okay.
But preschools for parents, what I would like to do is find a way to actually provide a district-run, free of charge preschool.
Wouldn't that be nice?
I think
So,
it can be done.
to
We
be
just have
studied?
to look at it. Yes, we are going to start studying that.
I hate to do this to you, but that tie knot, I have never seen a tie knot like that. When you were in the green room, I looked. I mean, what is this? You're very cool and hip. How did this happen?
Thank you.
What is it called?
This is the only way I could be cool and hip
I
anymore.
was going to say, you and me both. I mean, what is that? I've never seen that before.
This is called a Trinity knot.
Okay.
You could probably see why, right? 'Cause
Yes,
it's got
the three, the
fancy-
troika.
Someone described it as a strawberry today, right?
I think it's phenomenal.
Thank you. I was just playing around online on YouTube
That's
and
the trouble.
found it. Yeah, that's.
How long did it take to tie? Is it longer than?
It takes a little longer than the standard, wrap around twice through the
Well,
whole.
you're my new hero. There's no doubt about it.
just
Will
for
you
this.
teach me after?
Sure thing.
Okay, his name is Phil Hu. He is the Vice President of the San Gabriel Unified School District. I'm Brad Pomerance. You're watching Charter, California Edition.